Hi, welcome to Talking Brains, a podcast about mental health, books, and what makes brains happy. I'm your host, Dr. Stephanie Sarkis. Hello, everybody, and welcome to the Talking Brains podcast. Really appreciate you listening today. If you could please hit subscribe and click that rating button, give us a 5-star rating, that's appreciated. And today we have a return guest, Dr. Mark Bertin. Mark is a developmental pediatrician and author of How Children Thrive, Mindful Parenting for ADHD, and the ADHD Family Solution, which integrate mindfulness into the rest of evidence-based pediatric care. He's a contributing author for the book Teaching Mindfulness Skills to Kids and Teens. Dr. Bertin's on the faculty at New York Medical College and the Windward Teacher Training Institute, and on the advisory boards for the nonprofits Common Sense Media and Reach Out and Read. He's a regular contributor to Mindful Magazine, and his blog is available through mindful.org and Psychology Today. His latest Psychology Today post is Resilience and Routines for Families During the Pandemic. Dr. Bertin's website is developmentaldoctor.com. Well, welcome back to the podcast, Mark.
Hey, always great to be here. Good to see you.
Good to see you too. And you just posted this article on Psychology Today, and thankfully you sent it out to us and a group of friends to review. And I thought this was really helpful for families. I know a lot of families are going through a lot of uncertain times. We're kind of making things up as we go along. So what are some tips you have for parents that may be facing the fact that they're at home and their kids are out of school for 2-3 weeks? What are some tips you give to cope?
Well, I think we're all kind of learning about this on the fly. So, I wanted to try to contribute something that would help people just come up with routines that, deal with whatever's going on, and then it might change in a week again. And, that's part of the state of things. So, I think the starting point in, just as parents and understanding what to do for our kids is it really often just comes down to the basics initially, but just recognizing that in times like this, it's going to take some effort to come back to them. So I think the starting point as a family is looking at just what works for your family, what keeps your kids sane and rational in a long-term way. And those are probably starts with making routines that look at just keeping them exercising, keeping them on sleep routines, and doing what we can to keep them in touch with their friends some too. So I think, the starting point, I think, is about routine. It's really recognizing that when we're kind of knocked off balance like this, which is a kind of understatement, one of the ways we could go is to sort of just, let things fall apart in terms of routines at home. And it's probably a time to, give it a few days. I think a lot of families are just, where I'm living at least, are just going into, basically home lockdown. And you can sort of be a little unstructured for a while, but you're going to want to, while it's still early, come up with what the routine's going to look like that's going to keep everybody moving. And I think both as parents and as kids, getting into those routines are going to help all of us feel a little more resilient.
How would you recommend that parents set up their routine? Would you recommend that they write it down and put it as a schedule on the fridge maybe, or on the bathroom mirror? Or what are some ways that parents could get that down?
I think the more specific it is, the better. Although you can be, don't get overly rigid. It's more just about being consistent and have fun with it. It doesn't mean you're not going to be flexible. I mean, there's really two things we can look at, because there's general health, and then we can come back around to helping with school. In terms of general health, I think it's useful to either on a piece of paper or a whiteboard or on the bathroom mirror, try to make a list of some kind of what the day is going to look like. And, that might include exercise, that might include some family time. If you're lucky enough, that might include some outside time. What goes into being resilient in life? Resilience in the broadest mental health sense comes from family and social relationships and exercise and health and nutrition. And we can start there. So I think in terms of scheduling our day, even during these times, maybe on the days we're not doing academics, putting that on paper. And certainly one of the things we probably need to touch on, because it's such a stress for families, is prioritizing ahead of screen time, which is sort of the antithesis of resilience for most kids. And maybe using it a little bit of as a carrot and stick, like this is what the day is going to look like. You're going to get up, you have some school assignments to do, we're going to do some exercise. We can talk about ways to do that maybe while we're talking today, but you might have to really think out of the box. How are you going to get kids to exercise? It's kind of old school. It's like jumping jacks, looking for yoga online is a more modern way to do it, but just some way to keep people moving. I mean, I think that's, so foundational. Exercise all on its own more and more is become, the research is really showing is just part of health, mental health. I mean, it just is. So, and so kids, we can almost take advantage of the time at home. They might do it a couple of times a day.
I guess it sounds like you're advocating maybe positive reinforcement, like kids earning screen time.
Or just making it, I don't know how, during these times, I don't know if you'd want to make it, that literal, like you're going to have to earn it, because it, for better or worse, I think it's just part of family life for most families. And during these times isn't the time to start changing that. It's more just about prioritization, I think, is what I was getting at, of like, this is what your day is going to look like. It's like, this is the school day part of your day. So we're going to focus on getting stuff done. One thing I think it's really nice for many families to do is, just talk about family, supporting each other and responsibility. Maybe make a chore part of the day for everybody. We all got to keep our environment together. We're going to be in it together for a while. So you do schoolwork, we're going to do a little bit of chore, we're going to do a little bit of exercise, and then when you're done with that, which is a good lesson for all kids anyway. I mean, when, we're going to come out of this and we all want to be, it's not a terrible message to set kids up with anyway, of like, you get your stuff done that needs to get done first, you prioritize healthy things first, and then we can do some screen time, and that's so maybe not being quite as rule-based as you might be outside of the situation, but still valuable to come back to that. Although one thing I would say is, even during times like this, it really, for most kids, it's helpful to set really clean boundaries about how much screen time you're okay with, because you're just going to end up arguing about it and watching it spiral out of control for many kids if those boundaries aren't clear.
And what would you say for parents that are experiencing some pretty deep-rooted anxiety? Because I have parents have talked to me and they said, well, they don't really want to let their kids know how anxious they are, but at the same time, it's just kind of coming through when they're talking with their kids. How would you help parents that are feeling that sense of dread and kids kind of watch us like a hawk to see how they're supposed to behave? What would you say to those parents?
That's such a great question. I mean, it's a huge one. I think there's several specific things you can think about. One is certainly, like in any situation, start with your own resilience. It's almost like in times like this, I think we're often pushed and we end up doing less of the things that would actually help us feel better, because we're so off balance and being pulled so many different ways. And now we got to be at home taking care of our kids. And suddenly, we're not exercising, or we're not taking, 20 minutes for the hobby that just keeps us feel grounded and together. So I think one thing to think about in terms of your own anxiety in a family is definitely really, really overemphasize maybe the stuff as much as you can, as much as realistic, but just make sure you prioritize that and the people who keep you grounded. So, could reach out that way. I just got off the phone with a friend who's one of my closest friends in life, and we talk regularly, but we don't normally talk daily, but now we're going to for a while, and really prioritize all that. The next thing I think as a parent is prioritizing whatever tools you have for managing anxiety. Not everybody has specific tools, but seek them out. I mean, it's certainly something that I've found valuable in terms of my mindfulness practice, which I've had for a long time. So that's familiar to me. So it's, again, that same idea of like, the busier you get, the easier it is to not practice. But I find it, it's time to like double down and make sure I do. If you've learned some tools over time that help you manage your anxiety, make sure you over prioritize those too. And then the third and fourth thing, really monitor your news intake. I think part of the anxiety is that everything online and the news and the newspapers and some certain people individually even just, are like throwing fuel on the fire continually. And, the bottom line is that we need to try to seek out the facts as best as they're available. I think cutting through uncertainty whenever we can in terms of decision making can help. There's uncertainty of the situation that's unavoidable. But I think a lot of what's caused me stress and people I know stress is we're not getting very straightforward advice on like, do this or don't do this. And I think within our households, within our work, trying to get to the point where we can at least say, for this week, this is what we're doing. And just putting, just so that the decision making could be put aside for a little bit is really useful. It was really, personally, I would say the 36 hours between when I realized I had to do something different at work and figuring out what I was doing, there was stress that just like, I didn't know what the right answer was and no one was saying exactly what it was. So cut back on your news and be concrete in your decision making until the next point you're forced to make a different one, I guess. The thing about talking to kids is that there's balance to this. It's something I often, when I work with healthcare providers, I'm often talking with them, I do mindfulness for healthcare providers about how, we can't not acknowledge our emotions. And if we try to just smush them, they're generally going to just expand and come out some other way. So the balance is like, yeah, clearly in a provider role, we might not be able to express them in the way we would when we're talking to our best friend privately, but we also can't deny them fully. So, It's okay to admit you're anxious. And then, the really reassuring thing, at least you can tell kids, is that kids themselves, for the most part, are safe. And I really think we can all look at this, a little bit in terms of framing it for kids as, we are, in spite of how it feels, in spite of the fear and anxiety, you can look at it as like, we are mostly doing this to prevent, as a society, to come together and prevent the spread of this to other people. Most of us individually are probably going to be okay physically, and that's not to minimize everything else, but on some level, the message we can spin for kids is this is about taking care of ourselves and the community, and try to ground it from a more resilient perspective that way. And then you just have to be aware of monitoring what questions your kids have and trying to be open and honest with those too.
And in your article, you talk about how not to soothe kids with food.
I think what I actually said in the article is you don't want to be, creating a routine of that. You don't want to be, just like with screens, you don't want to be making your kids happy by turning to food all the time. I mean, I cook that's one of my main hobbies, and my kids too. It's like what we do as a family. And honestly, I think since we've been locked inside, we've been exploring new products to bake almost every day. So when you can use it as a way to come together, that's different. When we're all cooped up, we don't want to get caught up in overly short-term band-aids when things start getting stressful, because those are the sorts of things like that don't matter if you're on like an airplane flight. I always tell people that, like, whatever, screen rules, whatever you want to do. If you're trying to manage a short-term situation, you do what you got to do. But I think this situation is different. If every time the kids start bickering, you start throwing cookies at them, or if every time the kids start bickering, you put them back on the screen, that actually might lead to more bickering over time. So really what I was trying to get at with that is use treats judiciously. If we're going to really be home for the long haul, which where I'm living, they're talking about this could be going on for a month or more. Some of these things that help get a control over a situation right now aren't necessarily going to be sustainable for very long.
So again, look at Band-Aids versus long-term.
Yeah. I mean, and parents, none of us are perfect. Don't be looking for perfect or smooth all the time. But try to set yourself up so that you get into some routines over the next few weeks that are going to be able to sustain themselves.
What's a mindfulness practice that parents can teach their kids?
Let me just define that for a second first, because we haven't talked about mindfulness yet, and I just want to put that in perspective, because it can feel very forced in moments like this. Mindfulness is really meant to be, for the most part, like a gym program almost, like a long-term practice that will help you manage difficult situations just like this differently. So I just want to make sure I say that, because in the middle of crisis, somebody telling you to take a few breaths can feel really off-putting. So that's not what we're talking about here. However, in any situation where there's space for it, you can practice it, and honestly, it's not going to be a Band-Aid like we are just talking about. It's just like trying to introduce it, and hopefully if it clicks, it becomes something you can use to settle yourself. And that's really the bigger goal, is like, the core message of mindfulness, the reason it was first discussed centuries ago, is that life is inherently unsettling and off-putting a lot of the time, and we need to work on ways to manage that skillfully. So the starting point for most practices is really just looking at like, look, in a moment of crisis like this, our mind is going a million miles a minute, 100 different directions. The thoughts are sort of creating cascades of more thought, like it just sort of escalates. And there's just benefit to practicing, focusing yourself out of that for a moment, just breaking the cycle almost. And there's many, many implications to that. It's not even that, that's a simple way of looking at it. There's more to it. And that's the starting point, though. I'll talk about adults and then kids. First of all, like you alluded to around anxiety, if you did nothing else but practice it on your own as a parent, that would be teaching mindfulness to your kids in this space right now. Because if you spend time each day settling yourself a little bit, trying to see what's going on, another aspect of mindfulness is the assumption that when we're settled, we just see more clearly what's really going on. What more important in time than right now than to, try to stay settled enough that we can see clearly what needs to be done. That's mindfulness. Even being mindful that, like, I'm so anxious right now, I should or shouldn't do this. It's like, it's not saying you shouldn't be anxious. It's just clarity. So as an adult, we often start with something like a breathing practice, like a short breathing practice, because really it's more straightforward than it seems. It's not that that causes us to, have a quiet mind all of a sudden. It's just that there is some physical movement that you can pay attention to when you breathe. And that physical movement is, kind of right here, and it isn't all your thoughts. So it's just a place to focus for a moment to help your thoughts settle themselves down. And if you practice that regularly, it gets easier, in real life. So an adult practice, which you could start with, if you can carve out the time while you're at home, might just be finding online a mindfulness practice and doing that for 10 or 15 minutes. Or less or more, like whatever works. So because when it comes to teaching your kids, there's first of all, a lot of mindfulness is like living a certain way. It's how are we relating to this experience as best as we're able, and your kids will learn from it if you choose. So that isn't exactly the question you asked, but that often is you can only control in life, even as a parent, your own experience directly. So, your choice, if it works for you right now to practice mindfulness, will have a cumulative benefit for your whole family. And then developmentally, it's easier if you have some familiarity with it. Well, you don't have to, but it's easier. You can find ways that makes sense to your kids. So, for example, I have a practice online, which isn't mine by any means. It's been used forever, I think, where you just meditate or you focus on sounds for a few minutes. Kids can totally get that. And you can almost make a game of it. How many sounds can you? And you can, if you listen to the practice, you'd hear this. It's like, okay, what sounds do you hear in the environment? You don't, by the way, talk about this while it's going on. Just focus on sounds nearby a little bit. Focus on sounds far away a little bit. Focus on all of it together for a little bit. And again, it's that same sense of like, it's a specific activity that builds awareness and attention to some degree. And it's settling because inherently, while you're doing that, you're not engaged with everything else for just those few minutes. Although part of the practice is, of course, in real life, you are a little bit, you get distracted, you lose track of it, and that's all normal too. But you work on it over time. And you can do breathing practices with young kids. Like you can, in really young kids, one of the ways that sometimes you can do it is like you have them put a stuffed animal on their belly while they're lying still. And you ask them to very slowly see if you can rock your stuffed animal to sleep. And in essence, for those few moments, they're focusing on that physical movement and each breath again. But the easiest thing to know as a parent is it's all, there's no one way to do it. And it's about familiarizing yourself enough with it that you can start introducing it into the family in those ways. And there's layers and layers to this. Gratitude practice can be part of it, which is a great thing to do in moments like this. Just a little focus on what's going well. There's a lot more we could talk about even.
I'm thinking of something too that there's no wrong way to do it.
Oh, definitively not. I mean, one of the quickest way to stop practicing mindfulness is to go into it expecting it to be something specific, like now I'm going to feel calm or, now my mind's going to be totally quiet. That never really happens. It changes. I mean, how we think and how we experience life changes, or it'd be pointless to practice. But there's no expectation of like suddenly my mind's going to be still, or suddenly my mind, I'm going to feel great all the time. Certainly, that's not true. I mean, the reality is we just, we learn to, relate to whatever's going on a little differently, and a whole bunch of other stuff too. But in the middle of all that, your mind stays busy, and on any particular day you try practicing, you may feel really anxious and off, but it's still worthwhile. It's still part of the practice.
And just to switch tracks for a little bit, I've had parents ask me, their children are on stimulant medication for ADHD, and they're asking me if their kids should stop their medication while they're at home. And of course, I tell them that's outside my scope of practice and to talk to your prescriber. And I do tell them that studies have shown if you stay on the medication, you have a better quality of life. But what would you say to parents that are saying, well, my kids are home, and I'm a little concerned with how little they eat when they're on the medicine, so maybe I could just take them off of it when they're out of school. What would you say to that?
Well, that is a huge question. You could talk about many different ways, because I think most of what we're talking about would really apply to, all parents. Mm-hmm. With ADHD, I think there are three key points you brought up initially. The first is that profoundly on a day-to-day level, ADHD is not a school problem. ADHD is a intense medical disorder of self-regulation, self-management skills. It affects everybody differently, but it is certainly the rare exception and not the rule that you want to be managing ADHD just at school. I can't say I've never seen someone whose symptoms were only at school, but practically speaking, never. If you're going to be shut in for the next month or out of school for the next month, you want someone who can, that your child is going to have a better experience if they're able to manage themselves. And the medical recommendations around ADHD medications are pretty clearly for 7-day-a-week treatment at this point in time. So broadly speaking, that's true. The other thing you're alluding to, which is a major one, which unfortunately in the middle of a medical crisis, you might not be able to handle today, but it's important to know, is, once you're on the right stimulant medication, you should not have significant side effects. And that takes a ton of management. That's both my own personal experience, but also A research-based statement, 80 to 90% of people can use the stimulants without significant side effects. It just takes a lot of often really intensive trial and error. The other thread to what you said is once you're on the right medicine for the vast majority of people, you should just be comfortable being on it day to day anyway.
And thank you for gracefully answering that curveball question. There is one thing that you could have parents kind of take with them from listening to this episode. What would you tell them?
The bottom line we all need to focus on is that most of us, my only hesitation is this is a major medical issue. And, so this is in no way to minimize the fact that there are going to be serious medical implications for some people. For most families, there is going to be an endpoint. We are going to get through this, and there's nothing specific you need to be doing, and you can't be perfect at it, and it's going to be stressful and anxiety provoking, and all of that's normal. And all of us, any of us can do is just do our best within that. On a practical level, that probably involves providing just enough structure that everyone does their best to stay healthy and resilient, because our kids are going to rely on us for that. And even that's probably going to be a little imperfect. I think one thing we haven't touched on at all that relates to what I just said is that very specifically goes to school also. I come from a family of teachers. My whole field is in education, so I've been talking to teachers constantly. No one knows how this is all going to come together educationally, but I would say that kids they'll catch up. They will. I mean, it's not ideal in many ways, and I feel particularly concerned myself about kids taking AP classes and things. There's situations that are really challenging, and yet over the long haul, everyone's going to catch up, and the school system's going to figure out a way to, handle whatever just happened educationally. Because I think that's a major stress for a lot of parents right now, too. So I think all of it is, we're going to do our best, an impossible situation to manage, right. We're just going to do our best with it. And, that's all we can ask of ourselves as parents.
Well, thank you very much, Mark. I appreciate you coming on the podcast again and really helping parents deal with, again, a situation that we haven't faced before, and we're all kind of making it up as we go along. So I appreciate it very much.
Great. Well, thanks so much for having me. We'll talk again soon, I'm sure.
Sounds good. Thank you again to Dr. Mark Bertin, developmental pediatrician, for sharing with us how we can best adapt to this huge change in our routine right now. You can find him at developmentaldoctor.com. And please hit that subscribe button and also give us a 5-star rating. It's appreciated. And this is your host, Dr. Stephanie Sarkis, and I can be found at stephaniesarkis.com. Thank you.